Tourism, Housing, and Finance Committees. She is also the first freshman legislator in known history to be appointed to the Joint Legislative Budget Committee. Senator Boyd is a tireless advocate for individuals with special needs. She is the mother of a child with special needs and has worked and advocated at almost every level of government on education and disability reform. Senator Boyd is married to Dr. Daniel Boyd, a physician and small business owner. They have two children, Izzy and Spate. Senator Boyd chairs the Mississippi Senate Study Group on Women, Children, and Families and will address the findings. Senator Boyd, thank you so much for joining us in our conversation today.
Thank y'all for having me. I look forward to talking with you because I know y'all are going to have some great questions. And I have throughout this process that we have been working in this committee, and I'll tell you a little bit about that. The questions always incite us to think a little differently and think about this. And that's been kind of a really important thing in this process. I will tell y'all that before we have been working in the Mississippi Senate now, most of y'all know, for the past 2 years, trying to get postpartum legislation passed. And as somebody reminded me the other day, a gentleman did, and this will not, ladies will know what postpartum is, but the gentleman said, you know, you really just need to call that healthcare after a woman has a baby. They said, because when y'all say postpartum, I don't think most of my men friends understand what that means. So I'm trying to adjust my speaking to that. And if y'all are out speaking on it, you might want to adjust yours too. But we have been working very hard to pass postpartum legislation in the Senate. Last year it passed the Senate with only 4 dissenting votes because, and that was pretty much, it was the year before. It has been kind of, to us, this is a no-brainer. We know that we have the highest maternal mortality rate in the country. We know we have the highest infant mortality rate in the country. We know that we don't have a healthy population here. We know that there's lots of comorbidities that our mothers have, and that if we want mothers to be healthy, we also know that we have a substantially high number of single parent family households, and they are headed by women. And we need these women to be healthy. And we know that having healthy women gives them stability. It gives their whole family stability. So this has been something that's been very important to us in the Mississippi Senate. Both years, those bills have gone to the House, and we have pushed and pushed and pushed and pushed, and the House will not pass postpartum coverage. And we are going to continue to push on that. So we have been, we have kind of prepped, and we have kind of just been saying we have got to do this for the mothers of the state. You will notice that all of our surrounding states except Arkansas, and they have Medicaid expansion in that state, which makes that a little bit different because that means there's some better access for those women there. They've all passed postpartum. It has not been a partisan issue around the country. You don't see more red states having it or more blue states having it. This is a healthcare issue, we believe. So during the pandemic, the federal government put this in place. And so we're still operating with that, but we found some problems with how it's being executed in Mississippi. And I'll talk to y'all about that. So right now we do have postpartum, but it is only because of the emergency order. And I just was on the phone with Medicaid today. We had thought maybe President Biden would say that he was going to do away with that by the end of the year, and he did not. So we're looking on into January just because of the notice provisions and all of that. And I'm great with that because I want to see these mothers keep postpartum as long as possible, because there's been some real problems with the implementation of that. And I'll talk about that in a second. So we have been talking about postpartum in the Senate. Our lieutenant governor feels very compassionate about that. We have got to get this passed. We also I had been particularly looking at early intervention issues with our special needs population. children getting early intervention services and birth to 3. And I had kind of gone to the lieutenant governor with my concerns about our numbers, what was being done on that, just something that is a personal passion with me. And we had kind of gone through the various issues with that. And so after the Dobbs decision was announced, and there's a couple of other things too, adoption, foster care. We had been working with a number of things, kind of not really fully immersing ourselves, but kind of touching on some of those other issues too. I'm on judiciary aid, and my subcommittee, we had been kind of looking at all that. So when the Dobbs decision was announced, the lieutenant governor called me and said, we're going to do a study committee. And by the way, and I said, oh, that's fantastic. And he said, by the way, you're going to chair it. And, so know that when you stir up and start asking stuff, you may get asked that, but I really was excited. My background, just to tell you all a little bit, is years ago, I'm 54 or 53, almost 54. I worked for the Attorney General's office in Mississippi. I worked for Attorney General Mike Moore when we got the landmark tobacco settlement in. And was a young attorney and quickly had to learn public health and public health models, and which I know, Reverend, you know very well, but I did not, I have to tell you, when I was doing that, I think I got tasked with trying to help lead that effort, and I think I was 29 or 30, I can't remember, but I had fortunately some great teachers and some great professors that I called immediately and said, okay, help us figure out how to do this. So I was looking at all these things and know that, you know, we need to have basic good public health structure and how that we look at all these problems and issues. So I was pretty excited. The interesting thing when he called me, though, that I think I was taking notes as he called me, and he said, yes. I said, okay, are we going to look at, and I thought maybe the way he said it, we were just going to look at maternal and infant health care, but no, we were going to look at maternal infant health care and child care, workforce development for women, child support, adoption, foster care. And he said, I know, and you know, it's real important to you. So I know you'll figure it out some way, but I know you're going to put early intervention in there. So I looked at that and I went, that's 8 topics. And he said, yes, I want you to specifically look at birth through 3 as far as children, and then everything that involves the mom along the way. And I will tell y'all too, when we looked at maternal infant health care, I kind of let him know very quickly that we couldn't look at that without looking at prevention as well. We couldn't just start when the woman became pregnant. We had to start at prevention. So we zoned in, and I'll just tell y'all, just doing this type of thing in Mississippi is always a little bit of a challenge. I had that when we were looking at tobacco use and all that. So I thought it might be a little bit better, but it wasn't. The numbers of when we were looking at these young women that were having babies, particularly that were having terminations, we knew, first of all and foremost, that these were women that really were not ready to be a mother. They were not ready. And so we needed to look. And so I wanted to know who these women were, like how old they were, what this was for them. And so particularly, we really zoned in on that 19 to 24-year-old population, because that's where your majority of terminations are. These women, for the most part, are in some type of post-high school education, post-job training. They wanted to delay pregnancy, I'm sure, very much for economic reasons. And as I've talked to many of these women, they were very fearful that they would not be able to complete their education, complete their job training, because of these economic factors that were involved. And they have a very good point with this, because we know women who disrupt and we've presented lots of testimony with the hearings that we've had. And we know that the women who disrupt their learning and their education, we know the economic outcomes for them are not as high as those women who are able to complete that education. So we wanted to make sure that we did not lose sight, of those issues. Also to prevention. I will tell y'all, so the first kind of tell y'all the process a little bit is, and I'm jumping into the weeds here, and I'm sorry, I'm going to ramble a bit because when you talk about 8 different topics, you're going to get a little ADD on you. And I'll just tell you, I will get bad ADD on you. So if I get real bad, y'all put a note in the comments and said, weave back on this. But so just to kind of tell you the process, we had, I stopped counting at 50. I will tell you, I had 50 different meetings with partners in whether it be government, every agency that has any fingers or hands in any of these areas. And then I also met with healthcare providers all over the state, particularly went to some providers in the Delta with my FQHCs. I really leaned on them hard because they could really talk to me about the nurses that were seeing those young women. And really then talk to a lot of our college communities because we know that the termination rates are much, much higher in those college communities. And so talk to them about that. And so we did a lot of pre-meetings, and then we held hearings 4 days. And then we've had other meetings with this committee before that. So we had hearings in September. We had long hearing days. My colleagues told me that I could not plan. They were telling me because I basically got him in there at 9, and we finished up one night because we left from there and then we went straight to a dinner that was 3 hours long. So I had him in there from 9 in the morning till about 9:30 at night. And then the next day I had him from 9, and I made him go through lunch that day with different meetings. And so I had him in there till 5. Usually our committee hearings are a couple of hours. You come in, you do those. And so those committee, those first ones in September, we really did a state of the state. And so for my people on here, my professors on here, we did a state of the state, kind of looking at all the epidemiology, statistics and facts and stuff like that, so that I wanted my committee to really have a full picture of what the situation was in the state with the numbers and what those looked like for women and then their children that they were raising. And so Social Science Center at Mississippi State, in cooperation with the Population Center at the University of Mississippi, really worked to provide those numbers. That day we had the state health officer testify, and he has been very proactive trying to get postpartum coverage for women, and he is new. And so he really talked about all the comorbidity issues that these women have and the programs that we have at the health department. We have a number of programs at the health department. We don't have the reach that we need within the programs. Reverend, you probably see that in your area because we've got programs. We have a Healthy Moms and Healthy Children program, but it doesn't have the reach that we need. So we talked about the barriers and how that we needed to get more staffing to get that reach out to the program. It's a wraparound program, and it's a really good program. We just are not seeing enough people in that program. Then we talked about some of the other barriers. We also had UMMC. And we had a number of their faculty talk about those issues. They kind of outlined their patients. And we talked about what we did to decrease the maternal mortality that we have in the state and to decrease our preterm labor in the state. So we've got very high preterm labor in the state. At least 15% of the babies born in the state are preterm. That's a huge, huge number. And we know that that's dangerous, and we know the statistics that leads to. So UMMC had delved down actually in the numbers when they made the presentation. By the way, all these hearings are on YouTube. So if y'all want to listen to these directly yourself, they're on the Senate site, and these were the September hearings. So UMMC, we had asked them to really put pencil to paper because we know that it will only cost us in the state about even after we go, Medicaid, we go from we have the numbers that we have during the emergency order, which is a higher reimbursement rate. But even when we go to the lower reimbursement rate, this program of postpartum care will cost less than $8 million. Now, y'all, we funded golf courses in this state that cost $10 million, but we're not going to spend $8 million to help these mothers. I have a problem with that. The whole Senate has a problem with that. So we're very upset about it. And we're very upset with the House about it. I'll just be blunt about this. So we really, anyway, but UMMC showed that if all we did was reduce those preterm rates, because the children are in the NICU, that, the stays in the NICU are very expensive. If we just reduce the numbers at UMMC by 20%, we would pay for the cost of this program. I mean, this is prevention, and this will save dollars. So not only is it the right thing to do, it's also the economic thing to do. So that was really, really, those were the facts that we really need. And I will tell y'all, the senator that is in charge of Medicaid, Senator Blackwell, will be having hearings on this particular issue December the 1st. He is also a member of my committee, of the Women, Children's and Families Committee. And he will also, as chair of Medicaid, have additional people testifying on this. So that's been very good. Then we had Medicaid testify. And so let me tell you some things that we kind of learned in this process. And if you're Reverend, if you're a social worker in the Delta, you probably know all of these things, but here's the problem. So we know for women is that, we've found out a couple of things were real problems. First problem we found out is that, and there was an article actually in one of the online newspapers today in Jackson, and I'm sorry, y'all, I can't remember if it was Mississippi Today or I don't remember which one it was. But what happened is when women reached that 6-week mark, they were sent letters that basically said your Medicaid, even though they're supposed to have been able to stay on this through the pandemic, through this emergency order, they were sent letters that says you are no longer on your managed care system. And the way it reads, you would think, and anyone would think this, I don't care, our law professor would have thought that she no longer had coverage, because that's the way the letter read. They were supposed to receive a follow-up letter saying that they were going to go back on, instead of a managed care Medicaid, they were going to go back on just straight Medicaid, the Mississippi CAN program. Well, as most of us, anybody else in here having trouble receiving their mail, we found, and we had people testify, providers testify, that they didn't know that those women still had coverage. So they are telling them, we only can cover you at 6 weeks after this pregnancy. And they didn't know that they had coverage. We've had reports of pharmacists who didn't fill scripts for women because they didn't have, thanks, Jan, it was Mississippi Today, and y'all can read the article in there, and they've had continuing coverage about this, but we had pharmacists that didn't fill scripts because they didn't know that these women were still on it. So, hopefully it would have been a great opportunity to show, if we had done this and kind of done it well, that these were cost savings involved, because we got these women back on, their diabetes medication, their hypertension, all the comorbidities that we have in Mississippi. And look, I don't say that with any judgment, because you're talking to a mother who had tremendous postpartum issues, not with depression, but with just general health things. So I needed all that support afterwards. And I had excellent postpartum care. And I don't like to share my business like this, but I know how important this is for these women, because I was there. But I had good care. And I had insurance that gave me good care. These women, it's why I feel very passionate. They need to have that good care too, because I know what that meant for my child that I was raising, And I know what that meant for the future pregnancy I had. One of the other issues too that we found out is in this process, so is, it's very important for mothers to then go ahead and have that family planning before even she has the baby, that she's really thinking about prevention and family planning before she has that baby. And so when she leaves the hospital, there is some type of preventative family counts or planning that has gone on to whether she's either received some type of LARC or she's received something that gets her back on birth control. Because one of the main things that we, as the state health officer pointed out, is we have a real problem with mothers. And one of the reasons that we have such maternal mortality rates and infant mortality rates is that we don't do very well in the state with birth spacing. We get pregnant way too quickly after we've had that baby. And do y'all want to know this stuff like as I'm going through here, or do y'all want me to talk about this? I can kind of zoom in with some of this if I'm getting way too in the weeds here. Are y'all good with this? Okay.
I might suggest that you move a little bit to some of the outcomes.
Okay. Okay, I will do that. And so I will tell y'all too. Okay. So anyway, so we learned all these things, but we also learned too in the process that we have a problem with Medicaid reimbursement and LARCs. And LARCs are long-acting reversible contraception. So what we were finding out is that in this state, if you want to have a LARC placed in your arm and we know that those are highly effective, very, very effective birth control, 99.9%, they're the most effective out there, are an IUD. You have to go to the appointment with your provider. Then you have to go to the pharmacy with the script, and then you have to bring it back to the provider, which is totally impractical for women to do, because I don't know about y'all, but it takes forever to get an appointment. And then you're going to have to go get the script, bring it back. So as a result, and we have the numbers to show in Medicaid, very few LARCs were being used with women. We know that's the most efficacious birth control. So anyway, so I will tell y'all, because we need this and because we've pushed Medicaid is already working through those particular issues. I will tell you too that we had, even before the Board of Pharmacy today, we have trying to get a vending type machine with, that's temperature controlled in the doctor's offices today. We had that before the Board of Pharmacy today so that we can get these. It is easy for women to be able to get this most effective birth control. So we're already kind of working on those things. We're not having to have legislation. We're just pushing the issues through. And I will say this, when we brought this to attention to Medicaid, they have been working with us. And if you all see the video, you'll see the Medicaid director and I got a little fussy with each other. I will tell you, I got a little upset when we had our hearings, because I wanted to make sure that this is what should happen with women. This is ridiculous that they're having to go through this. So anyway, we are working on those particular issues. So infant health care, we kind of learned a great deal about that. Okay. So I want to talk just a second about, just to tell you too, we've done a good bit of work on child support. We looked at that extensively. We're doing a lot better than most people think on child support. The problem is we just have very low wages in the state, and we don't have a high workforce participation rate. With our gentleman, he should be paying child support. We don't have a great workforce participation rate, but we have done a really good bit of work on that. And so anyway, so we'll have a few suggestions on that. One of the things too that has been kind of a hindrance is, and this question came up today in looking at child support, or yesterday, actually, I had an employer call me. And so we are pulling the license for people that are behind on their child support. Well, that sounds like a great idea, but the problem is that means that person's not going to work especially if they have like a CDL license and they're a truck driver. That means you're taking away their ability to work. And that means that that family is not going to get any money from that. So we've got to work through some practical solutions on that. And so we're doing that. Also too, we have been looking extensively at childcare. And I will tell y'all, workforce development is something we're going to come back to, but until we solve this childcare issue, and really work to get A, more childcare out there, B, make it more affordable, and C, we've got to get rid of some of the impediments that we've put in place in the state for mothers who need those childcare vouchers. So we have put in the state, there was an act long before I got elected to the legislature that was put into place that if the woman did not name the father, she was not going to be able to get a number of benefits, including that childcare voucher. Well, that sounds all great and good that she should have to name him and then he should pay child support. But we all know and live in reality that there are many times that the woman does not need that father to be involved because of violence issues, because, domestic violence issues, because of a whole host of other things. As one young researcher reminded me, she was from the University of Mississippi, is, our teenage pregnancy issue, as she quickly said, is a grown man issue. And I have to tell you, I didn't know what she meant by that. And she had to explain it to me. And I see a few of you having the same look, is many, huge percentage of our teenage mothers, the father of the child that they're giving birth to is over the age of 20. So, those are particular issues. So when you realize that it is, anyway, is that yes, and Carol, you're right. The child care requirement is the child support requirement for childcare is not in state law. It is a DHS regulation. We are asking the governor to change that, but we are going to make that change. That is going to be a suggestion that will be in our legislative packet too. I can tell you that. It doesn't have to be done by law, but we will be doing it by law if, that's that. I do know the governor's office is looking at that. If there are any provisions there for women who chose not to keep the baby. So we have been looking extensively at adoption procedures in the state. And I will tell y'all, I will tell you, I was guilty of this. I wanted to say that I wanted us to be an adoption friendly state. And I really quickly realized that that was a great platitude, but that nobody really knows what that means. What is it to be an adoption friendly state? And so we have been working through the requirements, the laws that we have on that, and they're really not that stringent or that difficult. But what we need to do is clear up some of the issues at CPS with some of the adoption proceedings. For example, if they've had a home study, they don't need to have 3 more. There's little things like that we can clear up, but we have to be real careful on that, in the fact of we have to make sure that we are not making the adoption procedure such that it would allow a child to be the victim of human trafficking, which has happened in some other places. So you got to have that balance there of what is good laws. And so we have been definitely working on those procedures, looking at some things that make it easier on that. The other thing too that we have been looking at is foster care. All of the issues in foster care. And so many of you, I think, probably know on this is on foster care. The state has been under litigation, the Olivia Y case, for 16 years. And we have not made progress on this case like it needs to be because we have not instituted the procedures in place. So I will tell y'all, we are going to make a number of recommendations in this process, which we think should help facilitate and help children get to permanent placement and permanent homes. But also too, we're going to be supporting some of the efforts that they're doing in CPS right now. We have a new director who used to be a social worker, of making sure that they have the right supportive services for these children. We're going to be continuing with that, but we are going to have probably another committee that will meet now for a year. We're going to recommend that we have another committee because there's so many issues with foster care. We feel like we're just skimming the surface. And we think there needs to be much more. I will tell you, one of the things too that we have to do really kind of a review of that we've been looking at from the judicial standpoint is really a review of how we have the youth court process in the state. So if you're in like Lafayette County, anyway, we are now about to get our own full-time youth court judge in this county because we're going to have a county court judge, which we're, very excited about that. And don't forget to go vote on this next election because we're having a runoff. And it's exciting to see 2 women that are going to be up for that position. So that's very, very exciting. And I think they'll do a great job on youth court. But we have had, if you have a part-time judge, they don't have full-time staff either. And so we've got to kind of look at a whole system because we think we need to do really a review of the whole system across the state. And maybe it is that a couple of counties share a youth court judge, but that is their job. So that's one of the things that we're going to be recommending is that there's a whole judicial review system because a lot of the things break down at that youth court judge process. The other thing too is the staff for CPS. Quite frankly, they've not been adequately compensated. So we have high turnover and it's a job that is stressful, it's difficult, and we have high turnover and the pay is not appropriate for what they're doing. So the director has asked for additional increases of pay on that. And you're going to see that's going to be one of the things that we agree with and that we suggest that we do. Also back to this whole Olivia Y case, when this case came about, the referee that is looking at all of this said, y'all need to divide DHS and CPS apart from one another. Well, we did that and we really didn't properly divide them. And we didn't give CPS really the staff and the support it needs to operate independently of DHS. So there's some structural things from the state level that need to get fixed. And so we're going to be working very hard to get those things fixed from the state level with this. I will tell y'all too, one of the, and it's something we saw in a lot of issues that we had is the computer system that they're working under. Have any of y'all seen the computer system that CPS works under? It's from the dark ages. It is absolutely, and it doesn't tell a staff that's going in all the information they need, but that new computer system is, I'm so frustrated, but it's 18 months out, they're telling me. And I'm like, oh, because we need it, we needed it 2 years ago. But that's one of the things too, that's got to really get in place. So we're trying to dive deep into CPS, even to so that we're getting a count each week. I am as the committee chair as to where these children are, how many we have in hotel rooms. Like we had 10 last week still in hotel rooms. This is not acceptable. So we're going to be really kind of working and looking at those particular issues so that we know what's going to, how we need to progress on that. Okay, that's foster care. I've gone through this a little bit fast. Early intervention, I will tell y'all too, is a 1,592 is the children that we saw in early intervention last year in Mississippi. Anybody want to guess what that number statistically should have been? $10,000. So we are looking at, in fact, I have a meeting the Monday after Thanksgiving. We will be having a massive meeting with this. I actually have been working on this substantially, looking at the different systems that are in other states to really see more children and how we effectively see more children. We'll be making recommendations probably to increase the state's financial support of that program, because that program is funded federally, but we think we need some state dollars probably going into that program. The state health department has suggested that we increase our funding on that. But we are going to be looking at, it impacts this. Latanya, I didn't know you were on here, but it absolutely impacts the schools. You can preach on that. It very much impacts the schools. So we will be working very hard to see how that we can kind of maybe adjust the model that's being done, how it's being operated, and see that we can increase those numbers. So we have a higher percentage that should be in early intervention, because when you have lower socioeconomic levels, you have children who need more intervention because of health disparities, education disparities, all of those things. The wonderful thing about this is every economic study that is done on this. I mean, there's been Harvard economic studies on this saying that this is the most effective use of dollars of any program you can do, is to spend it in early intervention. And so if you don't think I'm preaching that right now, because this is where you save money, is by getting these kids this help, so that when Latanya has her babies come into her school, and you better believe they're her babies, I see her right here. When those babies come into her, hopefully she will never have to put them in a special education class if we've done our job in early intervention. Now, that's not going to happen for every child. That wouldn't have happened for my child, but my child got excellent early intervention right here in Oxford, when the program used to be at the regional center, and they've done away with that. It was fabulous. It was fantastic. And so the model kind of changed from doing it at all those regional centers. And you would go in, and I mean, y'all, it was just first rate with what we used to get there. And so we've got to get this back into, get this back into this. So, and Lori, you wrote up Medicaid expansion. I want to, just a second, I want to clarify something on this, is Medicaid expansion. That's a conversation we need to have. We need to do a thorough study of that. But the House leadership in Mississippi has said, oh, we can't do postpartum because it's Medicaid expansion. Y'all, that is not Medicaid expansion. It is extending services. We are not expanding the number of people who are going to be on Medicaid. All we are doing is extending their postpartum services. So, and as the state Medicaid director testified to that in our committee, and he kind of mumbles a little bit, but I assure you, so if you go back and listen to this, he said, well, if that was Medicaid expansion, every time the legislature went back and looked at the tech bill, which is usually almost every year now, the Medicaid technical bill, you have then expanded Medicaid, because we increased services, we increased reimbursement, all of that. We also had a lot of testimony in early intervention when it came to foster care and all of that, of our Medicaid reimbursement rates, because our Medicaid reimbursement rates are so low. And our private insurance reimbursement in the state is so low. What happens is, usually if Medicaid reimbursements are really low, but you have a higher private insurance rate, it kind of equals out a little bit, because people will say, okay, I'm not making any money over here, but because I've got this higher rate over here, I can absorb this loss over here. Well, the problem is, on our private reimbursement here in Mississippi, is some of the lowest in the country. And with our Medicaid reimbursement so low, they are not saying, well, we can't absorb this cost. So that's what happens. So what happens in the private market very much does affect them being able to accept more of the Medicaid. So what happens is, when you don't have providers that accept Medicaid, then for all those foster children, there's no place for them to get that's one of the reasons we're still out of compliance with the Libya WIPE. They can't get the They can't get the doctor's appointment that they need to check them out. They can't get the dental appointment that they need to check them out. So right now is one of the things the lieutenant governor is doing is trying to help them with UMMC, get these children in, get them to their doctor's appointments, because finding those care providers. I know my good friend Erin Smith, who's, and over Casa here in Oxford. I mean, she's having to help drive children to Corinth to get them through to the psychologist that they need, that will accept the Medicare if she can get them here. And so that's the things that we've got to close all those particular issues if we want to fix these systems. And so Medicaid reimbursement plays a huge role in this. And so Senator Blackwell will be having some more hearing. That's when after postpartum, he'll be having hearings kind of on that. He particularly was looking like at autism reimbursement rates and that. So we've asked Medicaid to look at all of those things too. And we've been meeting with them. Yes. So Ruth, okay, I'm going back first to questions. Lori brought up Medicaid expansion. We do have to, we're going to have to increase money on these programs, but the state's in a good position. I was in the elbow meeting last week. We're in a good position to be able to increase the supports for many of these programs. And so we need to take those excess dollars that we do have, increase support for those programs. But there's definitely, these things are going to definitely come with, a physical note to them where we increase those supports on that. That's going to be our recommendations, I believe. So we also need Medicaid to cover these mental health issues. Absolutely. We've got to. And again, that's where that reimbursement comes into play, because the reimbursement is so low right now, having to find those providers mental health provider is difficult enough. And then you put a very low reimbursement rates. There's no financial incentive for them to be able, to see this. Because if you can see somebody for this level, and because you could have a full patient base at this level, they're going to go ahead and see this level. And I mean, that's just human nature with that. So at least if we can do these, get these up a little bit, we'll have more of a chance for getting these babies into this mental health services, because we are at a crisis for that. We're also working kind of with our community mental health centers, seeing what we can do to kind of help with that. I will tell y'all, workforce development, we didn't get into as much as we would like to have. We're still going to be working on those issues. And the reason being is until we get some of these we're working to see what we can do in childcare. And we've been meeting with national groups. We've been meeting with lots of different groups, really looking at every ideal that we have right now of how we can get increased childcare. And then looking at the childcare workforce, comprehensive look at childcare. We're looking at the workforce that we have, how we can get more training with childcare. Even talking to, the Oxford School District, he was looking at some of his programs for CTE and the other day, and I snapped a picture because he had training childcare workers, options with that was a part of it. So we're looking at every part that we can in that. So we are in the meetings right now. It is a work in progress. And we are putting together kind of recommendations, but I will tell y'all, this has started discussions. I don't think it's going to end here. We've started the discussions and things that we needed to be discussing in this state for many, many years. And we haven't been discussing this. And no matter how you feel like that the Dobbs decision came down, whether you hated it, whether you loved it or whatever, it has pushed the needle in having the conversations that we should have been having for years now on all of these issues. And so that is what is really exciting to see what we can do and how we can do this and how that we can help these mothers create economic stability for their young families. And that's what we really want to do. So anyway, I'll be quiet and let y'all ask questions. I think I'm close to my time anyway. I did not as bad as I usually do. So, and I apologize for the rambling. This is just a lot of information. I could tell y'all go even into more depth on everything. So
there are several questions in the chat. And the first one is, what legislation emerge from the committee's work that will go to the 2023 legislative session?
Okay, Carol, we're still working on that. And like some of the things I mentioned to you today, you'll see us come out with a press conference with a big packet of legislation on that. I looked at Ohio's, I think they did theirs 2 weeks ago. And we'll have a substantial package. I've actually, the Attorney General's office, I have a big thick notebook of they've been working on issues too, especially when it comes to adoption, foster care, all those. So we will, I don't have the complete answer for you yet. There will be legislation really in every one of these issues that I mentioned, multiple pieces of legislation.
Okay, another is considering the maternal mortality and infant mortality issues that already exist, compounded by the closure of multiple OBGYN services, Medicaid expansion also seems to be a no-brainer. Neighboring states are benefiting from Medicaid expansion. Why not Mississippians?
Well, I can't, there have been no discussions about that because the House and the House leadership, y'all do know there's going to be a change in House leadership. He's announced that, but the House really has shut down any discussions in that regards, basically saying it will not happen under their watch. So there we need to have full discussions about this. We need to study this and look at this. But here's the, and there's some things too that I think are, all the states that have implemented this has been more expensive than they realized, but there's a lot of other states that have done it. So we need to study it and know what that true cost will be, for the state to implement it. There's too many things that I don't have the answers right now that I would like the answers to. But so we have not, basically, we could have all these hearings in the Senate and it never go anyplace and really look at that, or we can go ahead and move on issues that we know that need studying, like all the stuff we're working at, and know we can make some difference on those.
Let's see. Several of these you've already answered. You mentioned that a legislator was unfamiliar with the term postpartum. This seems to highlight the ignorance of basic sex terminology. Is sex education part of your committee's focus?
We have not talked about sex education on purpose, and I will tell you why on that. And 2024, that sex education law comes up for renewal. And so I think there will be lots of conversations on sex education when it comes to that. I had a wonderful meeting with some researchers here at the university, and I will tell y'all, one of the researchers, I think there's some basic misperceptions, but one of the researchers said, sex education starts in K, but it never talks about sex. What it talks about is social emotional learning, feeling secure in your body, feeling secure in yourself, and that those basic skills then translate to good, better, and smart decisions when it comes to sex education. And so she said it diminishes when you have good sex education early, because, and it's really about that social emotional learning and all of that. She said, do you diminish your people that fall victims to sex trafficking? And she kept going, listed a whole nother thing of it. And I thought, that's so true, because I think oftentimes too, I think the general public, and maybe, and I can't speak for my colleagues, my colleague was actually, he very much knew what postpartum was. He just thought we needed to change the verbiage really for the general public. But I think, and he really was right. I think we do need to change that verbiage for the public. So I think as y'all talk about it too, if we can really talk about, we're just talking about healthcare for the mother after she has the baby. But I think when we talk about sex education, I think most of us think about it being, unfortunately, where we were called into the classroom, maybe in the 7th or 8th grade, and we were shown the video. And that is not what sex education is. And I think that is the perception of what most people have of sex education. It is much more than that. And I think it's what they're really talking about is good social emotional learning, is where you're talking about, people and values and all of that. So I think there's a misperception there.
Okay. What was the racial background of the 19 to 24-year-old women that were studied?
It was the 19 to 24. I believe it was a 70-30 is what the population's numbers they were giving me. So I'm going to tell y'all too, the numbers I think are incredibly low of what we have. So right now they're telling me that it's between 5,000 and 6,000 of terminations with that. I think it was the 70%, maybe it was 68, 70 right in there. But it's so what they did is they're saying the 3,500 from the Jackson clinic. And then they're saying then there's an additional 1,500 to 2,500. All right. So that's where I'm having a little bit of difficulty. I think we're skewing low on this because there's 2 clinics in Memphis. There's a clinic in Tuscaloosa. There's a clinic in Birmingham. There's a clinic in Mobile. There's a clinic in New Orleans. There's a clinic in Baton Rouge. There's a clinic in Little Rock. So only saying that there was only 1,500 to 2,000 from another clinic, from all those clinics. I mean, like if you're in Oxford, if you're in Clarksdale, where you are, Reverend, they're not going to Jackson, they're going to Memphis. So I think these numbers are much higher. This is just me. Now my experts are telling me these are right. So it doesn't matter. We're still going to be working with this population. Y'all you may say, no, that sounds exactly right. And you may be right and I may be wrong on that. It just sounds that we have 3,500 in Jackson and then we're only going to add that 1,500 to 2,000. Just seems a little low to me based on how we travel and where we go for stuff. I don't know. Y'all tell me if y'all think that sounds right. So
It's not something we've really studied, so I'm not sure if we could answer that question. Another question is, will you summarize the results of the study as in research questions and answers?
Well, it really, it wasn't a study per se. They just presented data. And you can go back and watch that data. They presented the data to us. We did no per se studies. We had all the data presented to us. So yeah, that is not something we do as a legislature. The data is really presented to us from the studies and all of that. And there's so Mississippi State, with the help of the Center for Population Studies, and then we finished up with the Center for Population Studies. We started with the Mississippi State Social Science Research Center. I don't know how many of y'all are familiar with them. They do a great job, but they started us with basically everything, because we really wanted to create the profiles of families in Mississippi. We looked at their rent. We wanted to know their childcare, all of those particular things, food insecurities. We really tried to find out what that profile is. And then we kind of had, because that helped us as we're asking questions and things like that, to really kind of comprehensively look at that mom. And then we finished up to just making sure that we had done this. We finished up with the Center for Population Studies, going back through and presenting additional information, additional data that kind of reinforced what the original data was. So that just kind of helped us make sure we were sticking as much to the science and the facts as possible.
And was there a cost for this data to be put together?
There was not. Our universities, everybody pitched in. I will tell you this, that we all the universities, I mean, everybody knows this is a collective issue that we need to work on collectively as a state. And I have to tell you, we had way more people than wanted to testify than we would. But we also had a process that they could write into the committee, and they could testify. Even there was an ability for them to, if they wanted to provide oral testimony to the committee, they could, do that, or they could write into the committee. So we tried to be as transparent as possible. Somebody said if our study group was racially and socially diverse. I did not appoint the committee, but the committee was 3 women. It was then and racially, it was Senator Angela Turner Ford is from West Point, and she's African American. And then Senator Rod Hickman is he's probably the youngest member of the Senate, but he has a young child and he's very smart. And all 3 of us are fellows with the National Conference of State Legislators. He's in childhood poverty, and Senator Turner Ford and I are on child development. And then I think Senator Hickman and I are going back as fellows on maternal issues. So we're all 3 kind of work together a lot. So and then Angela Hill was the other female on the committee.
Okay. Are there plans for long-term support, like following up with the woman and child 2 years, 5 years, 10 years later?
I hope that we've just started a discussion that we're going to continue, because there's no way we're going to get through all the issues that we need to get through and really kind of keep going in the right direction. There's no way. And so, as I told you all, like workforce development, until we really do a better job on childcare, you can't really have that workforce development conversation, because the mother has to have a place to get her child. And I will tell y'all, this is an issue to me so it doesn't matter. So I have Lafayette and Panola, and I have all that industry area in Panola. And you go to every one of my manufacturers, and they will tell you, I'll say, what can we do? What do we need to do to help you with? It isn't taxes. It isn't anything like that. You know what it is? Childcare. Every one of them, it's childcare. So that's what we really want to try to do, is really help do this. I will tell y'all this statistic too, and I think this is an important statistic that really came out in the hearings. And it came out, people sending information, and it was so our workforce participation rate, do y'all know what that is in Mississippi? Okay, it's 55%. We're one of the lowest in the country. You know what our workforce participation rate is among our single mothers? 75%. So single mothers are out there working. And so they're not even though they're more educated than their male counterparts, because of childcare issues and stuff like that, they have lower wages because they're not able to take some of those jobs that are the higher paying jobs because of that. And so I think that's real important that people know these women are working. And I don't think that is. So somebody wants to know about, yes, I understand this. Do continued support for childcare crisis pregnancy centers. We will, the crisis pregnancy centers have been, I was familiar with them because I have a friend here in town. I don't know how familiar many of y'all are with them. It's not what you kind of think it is in some aspects. They really provide a lot of mentoring for these young women. They do a tremendous amount of mentoring, and it's more of that wraparound service that you want to see Reverend as the social worker. They're meeting with them and doing that. And so a friend of mine was like involved with the one here in Oxford. And so the young woman, faced with a pregnancy, wanted to keep her child. And so she started meeting with her. And I mean, she just got super involved with this young woman. She finished up her degree at Ole Miss, and then she went into the military. And there was some domestic violence. My friend went to court with her. They helped make sure I helped the child that day while they were in court. And I mean, she really just helped this woman, and this young woman is doing great. She is doing fantastic, but it's really more of that one-on-one wraparound that we would like to be able to do in government. We can't do that in government, and we just don't have the resources to do that. But and so that's the perfect role for the Crisis Pregnancy Center, or for other mentoring groups and stuff like that, is to really mentor those women one-on-one. And I have another friend who's doing that in Tupelo right now with a young woman and her husband. She's, helping them right now kind of get through this pregnancy that was not planned, but they want to keep it. And so she's been helping her do that. And she's finishing up her education right now to be a dental hygienist. And so anyway, it's a very neat process. It's also too very non-judgmental. They have abortion recovery groups. They have, and I think about half the women that go through these elected, and this is before the decision, elected, half of them went ahead and had the child, and then half of them elected not to. And so they have tried to meet the woman wherever she is. And they also do provide some support in diapers and strollers and, things like that, that, as you know, as a young mother, costs a tremendous amount of money. So anyway, one other piece of legislation, y'all, that we've got to get passed, and I think I've introduced it now 2 years, but we're going to see if we can get it done this year, is we got to do away with the taxes. They're called pink taxes. In other states, we got to do away with that. I mean, that's ridiculous that we're taxing that. And we need not, I think we need to think about the diapers and the formulas and all that stuff as we're doing this.
Okay, there's one other question. If resources were not an issue, what is the number one issue or thing you would say must be addressed as soon as possible?
Postpartum, the number one thing that we have to do right now is postpartum care. And here's why. We have, because of the maternal death rate and the infant mortality rate. And so we have got to help these mothers space those births out. And we have got to get that mother healthy back so she can take care of that child. Because I met with about 40 family physicians the other night, and they were talking about the basically anything that you've got wrong with you when pregnancy happens. Y'all know this, many of you do. It's greatly exacerbated. Like, so if you got a little bit of hypertension, you got a lot when you get through. And so preeclampsia, all those different things, and so diabetes and all of that. So if we could do one thing right now, it is get that postpartum passed. But we can do better than that. We can do a lot more.
How can we stay connected with your committee?
We are. I will try to do a better job social media posting. I have to tell y'all, I used to post a lot, and I have not been posting much lately in the political climate that we're in, with everybody mad at each other. It's just, I was just trying to let people know what was going on. I will do a better job. I'll post on my Senate Facebook page, but also know that if we have another committee meeting, they are going to, they'll be like, everything in the Senate is live streamed. You can't have a committee meeting unless it's live streamed. The lieutenant governor has been very, very insistent that there is transparency on everything. So, and it has been fun to watch, because that's been kind of a complete change since we got there. So, It has been great to kind of watch that, because I think I love it when I'm in a committee meeting, we have an issue come up and I'm getting text messages from my constituency going, I hate that, I like that, or you're wrong, you're right. So it's been good. And the childcare, I think somebody did the childcare thing too. The childcare is terrible. Y'all do know about what we got in Oxford though for this next year, right? Or that'll start in August of 23. So with this leadership of the chancellor, we went and we lobbied for a new state-of-the-art childcare center for this community that would be university based, and it would expand, and what they already have at Willie Price, it will greatly expand it. It will be available for special needs children as well. It is at the old hospital. It is in like the back part of the old hospital, like when you pulled in that drive right there, it's going to be over to the side there, and you actually drop off will be in the old parking garage. There's a whole thing that'll be there. And so the chancellor saw the need. There was a couple of reasons for it. There is a need for there's a need for leadership in this state on early child care. There's a need for that. Now, other universities have it. I'm not trying to say they don't, but there's a need for additional leadership on that and really training childcare workers on that. There's also a huge need in this community for some place to have, if you have a special needs child that takes childcare. As somebody who went out of the workforce because we couldn't find childcare, because y'all know I have a special needs child. Because anyway, I had to go out of the workforce because of it. I was one of those women. I like working, but I didn't need to do that at that time because of that. So anyway, but then also too, there was just such a need in this community for that. So we went and lobbied and we got that. So it's $10 million and it should be a state of the art, and they are going to, I think, run. So it should open up a lot of childcare slots in this community. So we're very, very excited about that. Representative Joyce and I are kind of worked with the chancellor and Perry Sansing on that particular project. And then our leadership with the lieutenant governor and the House and the Senate. So we're very excited. All right. Somebody asked about CTE programs in high school that offer certificate. Did you get any done? So good question. I'm supposed to be getting it, Ms. Kelly, but I don't have it completely yet. I know that Oxford is looking at that program to get additional people trained in that. So I'm trying to get the data statewide and the number of children that are in that program, both at our community colleges. I got the community colleges number. I got those numbers, but also then in our high schools as well. So we saw from a number of other places and states that there was a number of people that would get those certifications when they were in high school, and then they would essentially work their way through college, working at those childcare centers. And anyway, and hopefully going on and but as they were, kind of working through college, so it provided a great income source for them to do that. So anyway, so we're continuing to look at those. So we are the childcare. We had a lot of childcare workers that came to the testimony, and childcare owners of childcare centers that paid very decent wages and all of that, but they are like everybody else. They are desperate for employees right now. So.
Are there any other questions? I'm not seeing any more in the chat. Well, Senator Boyd, will you give us some closing comments?
I will. So I want to thank y'all really for being so interested in this. Do y'all have any other questions? I will just entertain really quickly. Do y'all have any other questions about stuff that's coming up in the session or things you've heard or you're concerned about?
Senator, I think you got all your questions and your comments through the chat, and we've been very, very appreciative of
Okay.
your time. Thank you.
Okay. Thank
And
y'all
if you have
very
a
much.
close- If you have a closing statement you'd like to wrap up,
I just thank y'all for allowing me to serve you. It has been an incredible experience. We've gotten some really great things done, particularly in regards to education. I am thrilled with the things we've been able to accomplish. There's a lot more to be accomplished. But we've made a good start in heading in the right direction and making those changes. So I appreciate y'all allowing me to serve you, and know that if you email me, I am reading them. And most of the time I try to, at least 99% of the time, to get back to everybody. So please email me. I do try to read them. I keep them on my phone so I can flip through them I read them several times a day. So anyway, please let me know what I can do for you, or if you need any help for anything. Thank you very much.
Thank you, Senator Boyd, for sharing your time with us tonight. And we'd like to thank everyone who joined us tonight. And we hope that you will have a good evening.
Thank you.
Dr. Ruth is going to come back now and have a few remarks.
No, just to thank also, I guess we can't quit thanking, but we do appreciate it, Senator Boyd, for you being here, and for you, Reverend Gillom. It was just great to have both of you. The League of Women Voters, I want you to know, Senator Boyd, that we are very interested in the package that's going to come out. We're the League of Women Voters. So we're going to have a special interest. And the men that join us are men who also care about that issue. The State League will have a table in the rotunda on legislation day on January 10th. We hope you'll come by. We hope some local people will be coming with Ruby and I, but we'll have plenty of other league members all around the state who also are very interested in this package and what's going to come out and what we can do to help get that passed and get these things passed that are been needed for so long. We appreciate you being here with us and willing to work with us. Everybody, I thank you so much for coming. It was a good turnout, and we'll be back in touch with you to see other more of interest programs for everybody. All right. Good night.
Good night.
Good night.